Welcome to the Healthy, Wealthy, and Smart podcast. Each week, we interview the best and brightest in physical therapy, wellness, and entrepreneurship. We give you cutting-edge information you need to live your best life, healthy, wealthy, and smart. The information in this podcast is for entertainment purposes only and should not be used as personalized medical advice. And now, here's your host, Dr. Karen Litzy.
Hey everybody, welcome back to the podcast. I'm your host, Karen Litzy, and today's episode is brought to you by the fine folks at Net Health. So Net Health is Redoc powered by XFit, which is a cloud-based, fully integrated EMR and billing solution. Plus, you can opt in to completely outsourced billing services, which is the best way to optimize revenue, so you're not leaving any money on the table for your clinic. Imagine PT billing, coding, and compliance experts taking the back office work off your hands and reporting to you, which allows you to do what you do best, grow your business and see your patients. To learn more about Redoc and the complete revenue cycle management services, check them out at nethealth.com/healthy. All right, on to today's episode. Guest host Jenna Kantor is back, and she is interviewing Juan Martin. So Juan Martin earned a Doctorate of Physical Therapy degree in 2007 from the New York Institute of Technology, and over the last 10 years has amassed significant expertise in orthopedics, women's health, including high-risk pregnancy, pediatrics, and neurological disorders, both within the acute and outpatient settings. She has continued to strengthen her skills and knowledge through mentorship with other amazing therapists within the field, as well as several continuing education courses to continue to focus on evidence-based treatments and solution. Her goal with JMM Health Solutions is to bring awareness to the area of pelvic health and all its associated issues, not only for the female, but also the male and pediatric populations. Just because it's common doesn't mean it's normal. And in today's episode, she and Jenna talk about her transition from outpatient orthopedics to pelvic health specialty, the stigma surrounding pelvic health conditions, and how to find a qualified pelvic health physical therapist. So thank you, ladies, for a great interview, and everyone enjoy.
Hello, this is Jenna Kantor. I have the pleasure of interviewing for Healthy, Wealthy, and Smart, and today I get to feature Juan Michelle Martin, who is the owner of JMM Health Solutions. And we are going to be, of course, if you know Juan, you will know we're going to be talking about pelvic health. So why do you think pelvic health is gaining popularity? That is the topic. She's so passionate. I've seen her videos. I follow her everywhere on social media. And I thought, oh my gosh, I need to feature this amazing, inspirational human being. So first, what is your response in general to people who ask, do physical therapists really do pelvic health?
So first of all, thank you so much for having me. And yes, we really do pelvic health because everybody has a pelvis.
This is true.
You think, okay, if I go and I hurt my knee, I get therapy for my knee. Or if I, tear a muscle, you think of an athlete, they can go get therapy for that. And your pelvis houses so many different muscles. You've got organs, connective tissue. So it's no different than anywhere else in the body. And there's no reason as to why, if there's an issue, there shouldn't be a solution for that region as well.
Yeah. Were you always a pelvic health physical therapist?
So no, I started off as an orthopedic therapist in an outpatient setting. But when I started 11 years ago, and as a new grad, when you come out, most of the experienced therapists would always send the patients they kind of didn't want your way. So that was usually pediatric patients and a lot of women for women's health issues, pregnant patients and so on. And I grew to love it. Fast forward a little bit, I worked next to a trauma surgeon, so I did tend to see a lot of women with pelvic fractures and men as well. And I found it really, really interesting. I had my own kids, and so I had my own experience with pelvic issues, and that just cemented it even more because I'd always wanted to dive into that niche, but then, having my own kids cemented it for me.
And on that note, we're going to take a quick break to hear from our sponsor, Net Health.
PTs, what do you hope to accomplish in 2018? I bet providing even better patient care and increasing revenue are top on the list. First, expand your visit capacity. Then get paid for your services, ramp up patient engagement, and eliminate worries about documentation and compliance. The good news is there's one solution that brings it all to the table. ReDoc, powered by XFit, is a cloud-based, fully integrated EMR and billing solution. Imagine PT billing, coding, compliance experts taking the back office work off your hands and reporting to you. Learn more about ReDoc and complete revenue cycle management services at nethealth.com/healthy.
That's great. So you would say your like big moment where you're going, yes, pelvic health is for me. What were your children?
Yes, definitely. Because after having them and speaking to a lot of other people, I had my issues and I knew what to do. You know, I speak to other people and they have issues and they have no clue. And then you realize the lack of knowledge that exists in society. And then there's also, you know, the stigma. Nobody wants to talk about it. You have issues, pelvic pain, pelvic organ prolapse, incontinence, you know, things are happening, people are suffering and nobody talks about it. And then the other thing is people don't know where to go. And I think that that's horrible, especially, you know, we've got all this knowledge, we've got all this technology, you know, there should be no reason that people that need help can't get the help they need.
That's true. Well, pelvic health, I'm just wondering, how long has it been around? Because it seems like it's gaining popularity, which is our topic, but some people still don't know about it.
So I mean, I've interacted with therapists, older therapists in the profession who've been treating issues such as this for, upwards of 20 years. But I think more so and more recently, there's been more popularity due in part to social media, due in part to a lot of celebrities, especially coming out. You know, you hear people talking about their own stories. You see commercials, which drives me nuts, but you see commercials with poised pads and stuff, you know, which kind of almost normalizes it. And, you know, myself and a lot of other clinicians typically will say it's common, but just because it's common doesn't mean it's normal. But they, you know, they've almost normalized it like, okay, you're peeing, here's a pad for that. And a lot of the people who are part of these commercials tend to be celebrities. So then people associate the celebrity with the issues. And then it's like, oh, wait, I've got that problem too. And so then I think it gains some traction and people talk about it and things of that sort. So I think in part, a lot of its popularity more recently has been due to social media.
Mm. So how can a person find a qualified physical therapist for pelvic health?
Word of mouth works really well. I mean, if you know somebody, you can always, you know, use them as a resource. But there are also a lot of different websites. The APTA section of Women's Health does offer a directory for therapists. Herman and Wallace also offers a directory for therapists. Tracy Shear's website, Pelvic Guru, I believe, also offers a directory. But again, you know, just in your community, some people will do Google searches. Some people may reach out to other outpatient physical therapy clinics because there may be a therapist within that clinic that works in pelvic health, may or may not be known. But again, ask if you're going to work with somebody, just ask them if they're familiar with whatever your situation may be, and then B, you know, what experience they have. Because, you know, they may or may not be, especially if you're just going to a general outpatient orthopedic practice.
For anyone who wants to seek out a pelvic health physical therapist, but they're fearful. I mean, this is a big deal. This is down in an area that's very private and personal. Right. What do you have to say to them to help them get that courage to just help them really get rid of the issue that they're dealing with? So, I mean,
the big thing is, you know, if you have an issue, you shouldn't suffer. You shouldn't have to suffer. And we as pelvic health therapists, I've never met a pelvic health therapist that is not passionate, about helping people and is not passionate about what they do. I mean, we didn't just get into it to, you know, say, oh, this is what I do. Like, we genuinely love to help people. Yeah. And we realize, I mean, I can pick out any therapist that I know that does this as well. And, you know, their passion, their goal is to help people and make sure they're not suffering and make sure that they have whatever it is that they need to be able to have the quality of life that they want, whether it's, you know, they're suffering from incontinence, you know, the social stigmas attached to it, or embarrassment, if they're having issues with prolapse, if they're having pain, you know, chronic pelvic pain or pain with sexual intercourse, or issues during pregnancy, or, you know, maybe, you know, they've just had a baby, they've got issues, they want to return to fitness, you know, you name it, anything that may be associated with your pelvis, you know, we are truly here to help you. And, you know, just find a therapist and talk to them, really talk to them. And first I would say, help them to get you to understand, because oftentimes a lot of people don't even know what's going on with them. I heard even, research typically states that a lot of people with chronic pelvic pain may see, as few as 7 professionals before they find somebody that figured out what was wrong with them. A lot of women are often told, oh, it's in your head, and when you get that enough, some people actually start to believe it's in their head, and they don't trust what's going on with themselves. And it's sad.
Yeah, it's so unfortunate. Well, thank you. Thank you so much for coming on today and sharing your wisdom. And then especially those last words you just gave, because nobody deserves to be unhealthy in any manner. So please, if you feel like you have any type of pelvic health issue, reach out, just Google, reach out, ask word of mouth, as she was saying, and you can get the help you need. Thank you so much for coming.
You're welcome. Thank you so much.
Thank you, ladies, for a great interview. And of course, thanks to our sponsor, Net Health, for sponsoring today's episode. So if you're unfamiliar with Net Health, they are the team behind Redoc, powered by XFit, a cloud-based, fully integrated EMR and billing solution. So if you want to expand your visit capacity, get paid for your services, and who doesn't want that? Ramp up patient engagement to keep them coming back, and eliminate worries about documentation and compliance. Then look no further. You have it all under one roof with Redoc, powered by XFit. To learn more about Redoc and the complete revenue cycle management services, go to nethealth.com/healthy.
Thank you for listening, and please subscribe to the podcast at podcast.healthywealthysmart.com. And don't forget to follow us on social media.